Yeah, no, I've got that's what, underneath my jacket. It's all my walk, my dog jumpers. Good evening. Welcome to Communities in Place Policy and Scrutiny Committee. Thank you for attending. I hope you had a lovely Christmas and are looking forward to 2026. I'm Councillor Finnegan and I'll be chairing your meeting this evening, supported by my Vice Chair, Councillor Jeffrey, and our officers and directors and other Cabinet members. Thank you. We are being live streamed and a broadcast will be available on the Council's YouTube page. We're not expecting a fire drill this evening, so if you hear alarm, please make your way to the nearest fire exits at the back and the central point, which is outside the Lynn Cross pub. May also remind everybody in the chamber to please switch off your mobile phones or turn them to silent mode. If members of the committee or other councillors wish to speak, could you please clearly raise your arm, wave, because I can sometimes don't see you. Sorry, it's a lot to look across. And remember to turn your microphones on when speaking, then off when you've finished. I think it would be very useful if we first all start off with some introductions. So starting on my right.
Hello, Paul Anderson, Director of Communities.
It's Nick Jenkins, Head of Leisure and Culture.
Hello, Andrew Smith, Head of Housing and Communities.
I'm Elsa Kill, I'm the Affordable Housing Enabling Officer.
Thank you. And Judy, on my left.
Judy Carboni, Democratic Services Officer.
Thank you. So we're just going to go item number 1, which is apologies for absence. So I'll say what I've got and Judy, please update me if I've missed anything. So Councillor Greenwood is on her way, but will be leaving by 7. We've got apologies from Councillor Utan, Councillor Butler, Councillor Brooks, but it's also lovely to see other councillors here this evening. Judy, do we have anybody else? Thank you. So item number 2 on the agenda is the minutes. Thank you, Judy, for producing those minutes. Have we received any comments on the last lot of minutes? No. Any more comments this evening? No. Well, I'm happy that it's an accurate reflection of the meeting held on the 5th of November. Are we all in agreement? Thank you. Item number 3 is actions from our last meeting. This is pages 13 to 14 of your pack. Questions were arising from HDC on carbon emissions 24-25, report considered by committee on the 5th of November. An update was circulated to members prior to the meeting and was attached for information. It sets out in a table carbon emissions at Hill Cemetery Chapel, Hobhost Depot and Southwater Country Park for a 6-year period and provides some commentary on the likely reasons for the increases last year. Item number 4 is declarations of interest. Do we have any declarations of interest? No, thank you. Announcements. We've got none from the Chief Executive, but I've got one announcement on agenda item number 11. Members will note that this item, refurbishment and leasing of the property, includes an exempt appendix, which details the premises. The exempt appendix also provides additional detail on the capital expenditure budget request and ongoing revenue impacts. The premises and resource consequences are on pages 65 to 67 of the members' report. It may be possible to discuss this item in general terms. However, members should be aware that any discussion relating to matters in this exempt appendix would require us to move to an exempt session, so offline. The reasons for this are attached in the agenda. Item number 6, resolution for call-ins. We have none. Item number 7 is response of the full council. We have none on that either. So we're moving to agenda item number 8. This is housing strategy 26 to 2030 and pages 15 to 46 of your pack. HDC's existing housing and homeless strategy expires in 2026. Much has changed since it was developed as we came out of the pandemic. The council has a statutory responsibility to publish a homelessness strategy every 5 years. The Council has been working with partners to address both national and local challenges and has developed 6 objectives which feed into an action plan. Last week, we had a briefing from Elsa Keogh, Andrew Smith and Councillor Raby, all of whom have said they really welcome comments, not only now before Cabinet approval, but as a living document as new ideas come forward or the landscape changes. We're going to receive a draft Cabinet report from Andrew Smith, Head of Housing Community Services. So I hand over. Thank you.
Thank you very much, Chairman. I'm used to delegating, so I'm going to delegate this particular responsibility to Elsa Keogh, the Housing Enabling and Strategy Lead, who has crafted the strategy in consultation with partners and various other people.
Nice to meet you all, for those I haven't met. We did do a members briefing last week, but just briefly, the strategy is for the next 5 years. It's a legal requirement. We've based this strategy off the information we got from our housing summit that was held in July last year, where we got all the stakeholders in one room. They gave us feedback on what they'd like to see us deliver in the next 5 years. They were also consulted on that once we had drafted it, and then this is what's brought out this piece of work. As mentioned, there's 6 key objectives: reducing rough sleeping, preventing homelessness, increasing accommodation options, maintaining a fair and accessible housing register, supporting residents to live independently, and delivering the number and types of housing we need. As mentioned also before, this is a live document, so it will be for the next 5 years, but we plan to review it yearly and make any adaptations as and when required. As we know, the world of housing changes every week at this rate, so we want to be able to keep it as up to date as possible and relevant for local residents. But yeah, that's it.
I think I would just want to add that we would expect this to bring the review of the strategy back to this committee next year, because it's easy to say, oh, this is a living document, and we'll work on it, and we'll make these additions, and we'll respond to national and local challenges. But the thing is, the strategy is only going to be relevant if it is an agile document, because things are changing rapidly with government policy. The needs within our sort of district have sort of changed over the years, and we need to be able to respond to that and implement solutions that will do the very best we can as a local authority to meet needs.
Thank you for that further update. Thank you, guys. So at the briefing and previously, I'd already suggested some initiatives, which, for example, the 2 generations, whereby a vetted younger person can live with an older person for an affordable rent in exchange for offering up their time, help or companionship. Others during our briefing offered or made some suggestions to some of the wording, and we also discussed the Turning Tides project and the lessons learned moving forward. Also, from experience on the Glebe Farm application, I think working with the developers to ensure that the size of affordable housing meets the needs of the housing register is achievable if councillors work in advance on that, and that's something that sort of councillors can do themselves. I'd like to know whether you can commit to looking at the 2 generation type initiatives. I'd also like to know what will be done to remain transparent and on track. Will you be publishing KPIs? Will you consider sort of a traffic light performance update or resident friendly summaries? I also know that Councillor Jeffrey has some comments, but I'll hand over you to respond to some of those. Thank you.
In relation to the transparency, yes, we are going to publish the KPIs yearly. We're also going to go back to stakeholders yearly as well for any feedback that they think is working and not working. And we hope to come back to policy and scrutiny as well to review that. The older age person, yes, we haven't added it as of yet, just because we need to do a bit more investigatory work of how that's actually going to work. We don't want to negatively impact any of the residents in terms of the housing benefit requirements. So once we're able to carry out that bit of work, it's something we'll definitely want to explore. But yeah, I think that answers both.
Thank you. And Councillor Jeffrey, you had some questions. I just wanted to make sure that you had a response or you want to discuss that in public. Thank you.
Thank you, Chair. There was just a few areas that I wanted to follow up on in the meeting, if that's okay. So one of the questions I asked was around the number of private landlords currently working with the council, whether that be on the leasing side or the private rental market. I was a little bit surprised actually to see that we don't actually have any landlords taking up the leasing aspect as of yet, which comes with a lot more benefits than to the private rental market. Obviously, full management services, no management fees, full contact with tenants, it's taken care of for them. Is there do we know there's a particular driver why we haven't got anyone signing up to the leasing side at the moment? Because I wasn't expecting to be masses, but to have nobody was quite a surprise, I have to admit.
So what we think is we did the private sector leasing initiative about 2 years ago, and we already had that number that we have currently working with us. We already do that lettings management end of stuff for the 24 we have, even though they're not technically under the private sector scheme. But what we're finding at the minute is there just wasn't any drive for them to join us because they're already set up with letting agents and things like that. What we're hoping is now with renters' rights coming in, there's going to be even more of a drive to join something like this. We need to do a bit more advertisement about we're here, we're available. We were reluctant to do that at the beginning because we didn't have the adequate resources. Now we do, we're up and running, we're more sufficient to take it on. But what we're hoping is letting agents at the minute charge 12.5%. We charge nothing. And they're also going to have additional costs because of rent and mold issues and just tenancy statements. So we think it's going to be an awful lot more appealing moving forward than it has been previously. So we're just hoping that the turn tide. But at the end of the day, if the landlords are still out there in the district and are doing what we need them to do, it's still a benefit. They don't necessarily have to be on our books for us to see the benefits of that. It's just they get benefits more so.
Just to follow up on that very quickly as well, part of one of the answers I got in advance was when I asked what the fallback position was if the private rental sector continues to decline. One of the comments I got was that we continue to offer them the incentives to try and strengthen that bond, and especially around the leasing schemes. So as I've just covered, we haven't got anyone on the leasing schemes at the moment. You just explained what we're trying to do to mitigate that. But what other incentives can we actually provide them realistically? For example, I understand, there's going to be difficulty with landlords having rent in advance with the new renters' rights bill coming in. But is there other barriers, such as a local authority? A lot of the people on our housing list aren't going to be able to pay market rent, which is why they're on our social housing list in the first instance, because private renting is unaffordable. So is that another barrier that we're experiencing with getting people to onboard on the leasing side? Because I assume, this is just me assuming at this point, that we're not going to be charging people market rents necessarily through that. We're going to be more near the social rent end, and maybe that's not as incentivizing for a private landlord to take up, even if it is a guaranteed income. Mm-hmm.
So yeah, we are closer to the local housing allowance rate than we would be than open market and what they can offer. But we do have tenants that we work with that can go further up in the price range if they're working households, the likes of that. I would say the biggest barrier for us in Horsham at the minute is actually just the lack of stock available in private rented. There's just not much private rented out there at all. What is out there is either not affordable or not really up to standards that we would like to see. So it's more just trying to drum up interest of people doing privately rented in this district. The problem we've also got is it's very expensive to buy properties. As a result, it's not actually beneficial for landlords to buy a property to rent out here when they can go 15-20 minutes up the road to Crawley and buy a house for much cheaper and rent it out at a similar kind of rent. So that's the more issue we've got, I would say.
Yeah, just a final follow up, and then I'll leave this point. Is so as you explained, there's challenges around the affordability of property, as you've rightly pointed out. But have we looked at any other incentives we can provide other than the rental side of things, the guaranteed rental income? Because I'm not convinced that's necessarily going to be enough. Yeah. To convince enough private landlords to onboard on the scheme, even with the renters' rights bill coming in, to mitigate against any forecasted decline in the private renter sector. If that does come about, obviously we're forecasting here, so it might not necessarily be that case. It might increase and it might have a bounce back. But I'm just not convinced that at the moment, without further incentive, that we would onboard enough landlords under that leasing scheme, for example, to mitigate for continued decline. I just don't think there's enough meat on the bone for them. I fully appreciate we most likely don't have the answers at this point, but is that something we're actively exploring further?
So you can tell me if I talk out of term here. It is something we're actually exploring. I can't tell you in detail unless Andrew knows off the top of his head what it's going to look like. But it is something. The problem we've got is we're a bit restricted in terms of funding and what that can look like. But we are looking at it with the renters' rights coming in. We're going to be looking at a tenancy relations officer and things like that, and that will all link in. We'll have one for the tenant and one for the landlords, so it'll help to build the relationship in that sense, because they have to sign on for the database. We'll know who they are, and then hopefully we can reach out and say, "Hi, we're here. We offer this service," and then it opens the doors a bit more. Where at the moment we don't actually know where they are in the district and who they are, so that's another barrier that will hopefully be eliminated with the new database that will come in hopefully, I think, the next 18 months. I think it is meant to be introduced.
Yeah, I think that's right, Councillor, if I can just add a bit to that. We don't know where all the private landlords are, but all of them are going to have to register under the new Act on a portal that we will set up and run. That gives us an opportunity then to target, incentivise landlords and say, look, we offer this package, sort of trouble-free renting. You can get more than a month's rent in advance, management fee 0, and we will provide a tenant and we will look after that tenant and do the housing management. You'll have your rental. Clearly it won't be a market rent, but it'll be a steady income. So at the moment it's very difficult to know who we can actually speak to about this, but when the portal comes in and all private landlords have to register, as Elsa says, that does give us an opportunity to go out, do some marketing.
Councillor Jeffrey, you may have some more questions. I'm just going to jump in at a point of order, that we've received apologies from Councillor Grant, and I also just wanted to check, welcome Councillor Greenwood, just want to check, do you have any declarations of interest on tonight's agenda? Okay, thank you. Sorry to interrupt that. Councillor Jeffrey, do you have any further questions?
I'm going to be quiet for the moment and let others actually contribute, Chair.
Thank you. Okay, I'll open it up first of all to any committee members. Do you have any questions? I'm going to go to Councillor Beard first. Thank you.
Yeah, I just want to speak to the two generations and the benefit I think that will do. If you think back to how we were before we were all separately boxed, for want of another way of saying, we used to share skills, we used to share knowledge, and this is such an opportunity where generations can come together and support each other, be it for someone like my mum, I've just lost my dad, so my mum who's in a house that has space, and for when she's ready, that have someone who can help her tend the land, help keep her company at night, and just be that. For me, as a daughter, as a human being, can see the benefits of that being utterly huge, and with the knowledge that you can go through age concern and everything can be vetted, so we have the safety network of that, and there's brilliant organisations, Home Shares and other, that will bring that to such a positive light and help financially those who need, and those who need come and find an equal footing. Thank you.
Thank you, Councillor Beard. Would you like to respond anything further on that?
Yeah, I can say a little something on that, Chair. It is something we will investigate. It does sound lovely, but there are all sorts of things that have to be put into place. After this item, I'm going to be speaking about our work with Age UK, and that is one of the areas that we want to work with them on, because they, across the country, have been involved in these particular schemes. So we need to find an agency and expertise to help us see how we can enable that to happen. So, yes.
Thank you. And just to jump back to your responses earlier, Elsa, thank you for letting us know that the KPIs will be published. Will that be on the website, the HDC website, or is it transparent?
Yeah, I would hope to have it as one web page that would be dedicated to this, and then we could update things like KPIs and stuff. I'm still working with IT about how that's logistically going to work, but I would like one hub where it would be live document, and then you could add updates and KPIs and things like that alongside it.
Thank you. And further to that, you said you'll be happy to come back to scrutiny, so I'd like to sort of put a point down that we'd like to invite you back annually to see how things are going. Thank you. Councillor Clark, I think you had a question.
Thank you, Chairman. I've got 5 questions. Starting off at the beginning, I read the document. I thought it was very, very interesting. I learnt a lot, but I found it rather aspirational. And I ended up asking myself questions like the first 6 bullets on page 24. You know, okay, so now what? You know, how are you going to deliver? I read the words, but, you know, what's going to come from that? And it left me wondering. Looking at the first point, in the, you're talking about, on page 29, the housing register data for 50% of applicants looking to move for overcrowding. Unfortunately, the lifting of the 2-child benefit cap will make that worse. But sitting on the planning committee as well, I look at what's coming through on the planning committee, and I think we on the planning committee need to help you get those houses, because, not wishing to go into particulars, 3 and 4 bedroom houses are like hen's teeth, and we need a lot more of them. Our planning system seems to be geared to the 1 and 2 bedroom houses, and I think that needs to change. So my question is working with the planning people, I don't know if it's appropriate, but surely this is a case for updating the SHMA and the way that our planning people look at it. I mean, maybe you can comment on that. Are you doing something about it?
So we have been working with planning colleagues closely in relation to this. The problem is with the local plan, it doesn't make sense to update the SMAR right now, but it is a piece of work that desperately needs to be done. We're very aware of it. What I would echo is any planning response that has affordable housing being delivered, I send comments on, and I send that exact parish demand every time. And I have started to get a little bit bolder in my comments, in the sense of I really don't support it if it's going to be 1 and 2 bed flats. And it is going to start coming across as aggressive, and the developers are going to be sick listening to me. But the reality is we're talking about a 1 to 2 year wait for a 1 or 2 bed compared to a 10 to 15 year wait for a 3 to 4 bed. And we just can't tolerate it anymore. So I do, if you can be advocates for me at the planning committee, that's great, because I'm nearly blue into the face till I say it now. But yeah, that's our biggest thing we would like to target, definitely.
I think another thing that we've said, and we've reiterated, and I've reiterated this over all my years in housing really, is that we need to get involved in discussions with developers early. And say worst effect, you know, you might get an easier ride through planning if you provide what we need. And because there is now more need for adapted housing, or housing that could be fairly straightforwardly adapted for disabled households, the needs have changed quite considerably, and it's not only physical adaptations. There's all sorts of issues around folks with mental health and families with difficulties that need particular facilities in the housing that they will be allocated. So the earlier we can get to talk to developers, and we have a very good relationship with our planning officers, we work very, very closely together with both strategic planning and development management, to get those discussions early. And as I said at the member briefing, and I've said it before, the committee decision is crucial, because if the committee decision is not very prescriptive, then when we come to do the 106 and get that sort of button down, it can be too vague. So I think, you know, for those on the planning committee, your role in enabling us to achieve this is absolutely fundamental.
Thank you. I know that the chairman of planning is here, so I'm sure he's listening very carefully to what's being said. And also we are acting to be more involved with the 106s when they're drafted and getting it at an early stage, which should be helpful. So thank you for that answer.
Councillor Clark, just before you go on to your next question, perhaps I just give the chance to Councillor Ayres-Brown to respond to that as chair. Thank you.
Fully agree with the officer that there needs to be early engagement in the process. One thing we need to be mindful of, we shouldn't be prescriptive at the committee stage. All we should say is that whatever percentage is going to be affordable. They run the risk, as if we are prescriptive and we don't negotiate that in the 106, it would have to come back to committee. But I think it's important that you are involved at a very early stage and involved in the Section 106 agreement, so we can start to push to get the houses that we need, in the tenure of houses that we need in the affordable element of the Section 106. Thank you.
Councillor Clark, I know you've got another question, but Councillor Livingston would like to reply about that same topic as well, if that's okay.
I forgot to mention Councillor Livingston because he always brings up the problem of
We
accessibility.
know what's coming. Thank you.
Thanks, Councillor Clark. Councillor Finnegan. We've got an increasing ageing population and disabled population. Now, our planning officers are very reluctant to ask what type of housing is being produced. We seem to be building 3-storey buildings. They're not, as under the building regulations, M42 or M43. So that's accessible and or disabled. We're not doing those. They're not even asking developers. So I think we need pressure from other officers, from yourselves, to make sure that in future, when we've got estates coming in to get their planning permission, that we know what is being provided. The NPPF, which is under consultation at the moment, is looking at 40% as a minimum. Well, the last couple of housing estates, we've got 0%, which is really not good enough. Thank you, that's what I'm going to say.
Officers, would you like to respond to that before I go back to Councillor Clark?
Only that I would support what Councillor Livingston has said. I don't think there's anything we can answer on that, but yes, absolutely. And it's something we all need to work on to make sure that we have the homes, not only the affordable homes, but the market homes as well that we need. The whole spectrum needs to be meeting the needs of the district. So yes, I would agree.
Thank you. And sorry to have interrupted that. Councillor Clark, back to you.
No problem, Chairman. I refer to comment 6.1 in the Cabinet paper and also the action plan bullet number 1. And when I look at the text on page 33 and what we've achieved and will build on, like delivering financial assistance schemes such as rent in advance and tenancy sustainment, the Cabinet paper says it doesn't cost us any money. All the rest of it is telling me it's costing us some money. So maybe you can clarify that for me, please.
So the funding to resource the likes of that are coming from like homeless prevention grant funding, rough sleeper initiative funding, which all comes from MHCLG, the government, and they give us pots of money. So it's not coming from our capital or benefit. And that money every year depends on how much prevention work we do. So the more prevention work we do in the likes of paying off rent arrears or rent in advance and deposit for people, the more pot of money they'll give us the following year, because that's their incentive, is for us to be preventing homelessness. So we draw from that pot of money each year, so there won't be a budget implication as a result of that. Do you have anything else?
So if you're going to buy a fridge for somebody or a new bed or something, it's straight in and straight out. So it's cash. What you're saying is it's cash neutral for us.
Yes.
Yes. So we can use government money in whatever way we choose to prevent homelessness. So we're constantly reviewing each year about how we best use the homelessness prevention grant that comes and the rough sleeper initiative grant. So, for example, in the action plan, it speaks about bringing rough sleeper outreach workers in-house. Before we paid turning tides to do that. Now we think we need to bring them in-house, manage them perhaps more closely, work across the district more rather than just around Horsham town, and so that we can reduce rough sleeping, which has increased, and most of you councillors will know that it has because of what you've seen in your wards, and your constituents have flagged people. So we want to be able to make sure that we really do get alongside those people who are rough sleeping, try and establish why, try and establish them to engage with services, and try to enable them to secure settled accommodation. That's a fairly long-term piece of work, because many of those that we talk to have serious and long-term chronic issues of alcohol abuse, substance abuse, mental health issues. It's never one thing. There's always a combination. And it's not really ultimately anything to do with not having anywhere to hang your hat, because we could accommodate them all. But if they're not willing and they won't engage with services, or they won't sign forms because they're terrified that their data will somehow get somewhere, you've got to deal very carefully. You have to deal with them very carefully and very sympathetically and very consistently, which as well in the action plan we talk about a rough sleeper having a dedicated worker, another reason we want to bring that in-house. Now, that's just reprofiling the money we get from government. It's not additional money in the budget. So I think it's trying to always find the best ways to use the resources that we have to meet the changing need.
Councillor Clark.
Thank you. Paragraph 4 talks about maintaining an accessible and fair housing register. I'm not going to read it all through. It talks about being clear, fair and accessible. And my question is, how is the weighting done and who actually judges whether it's fair or not?
So our lovely reviewed housing register policy, which was done last year, basically sets out a standard that each officer has to follow. So it's got clear guidance on who's eligible, what their banding should be, and where they should be housed, likes of suitability, do they need wheelchair adapted, etc. So this policy that we have, the officers have to use to identify the need, which means we get rid of that officer ad hoc decisions of, do they think, is it black or white, is it not? It's clear cut, it's down to the letter in the policy of what they should be doing and how they should be allocating. So we feel it's fairer then of who's getting what housing. And in terms of, we also try to be quite fair in the district in terms that we give areas of choice in terms of where people want to live. Because we're so rural, we feel like we have to give that choice. Crawley and the likes of that do auto bidding for their homeless applicants. We couldn't do that. We couldn't say, just because you're homeless, you now have to go live in Ashington where there's no transport and you don't have a car. It's just not possible. So we try to look at the housing register policy from a fair perspective for the customer as well. What is reasonable to expect from them? So we left in the things of areas of choice. We also look at things like income. What is the threshold for income in terms of a household, whether it be a single applicant or 2-adult household? How much can they be earning before we would say that they're no longer eligible for affordable housing as such? So it's reviewing things like that, because as we know, cost of living, everything's gone up. Do we need to review how much that cut-off point is? Is it on the threshold now of it is actually not affordable anymore? And it's small things like that that we're yearly reviewing. We're also asking the customer to put in a review each year so that we can review their circumstances. Has anything changed? Have they lost a job? Are they now driving? They can consider additional areas. So it's just trying to cover it all around to make sure that that person's application is up to date, our policy is up to date as possible, and we're able to house that person as efficiently and as quickly as possible. Given the situation, obviously we're limited in stock, but once they're ready to go and the house is ready there, then they're just matched up really quickly and seamlessly.
So, of course, another factor in that, of course, is local family network or local support network, if I can loosely use that, how one depends on family members in a neighbourhood and stuff, and that's quite important. Unfortunately, it militates against some people because they want to live in a particular area because of that, and there's nothing there for them. So they're caught in a cleft stick, really, which is difficult. I continue?
Councillor Clark, are you on question 4 now, or is it question 5?
I'm going to number 4, yeah.
Yeah, perfect. Carry on, please. Thank you.
Got to find number 4. Yeah, it's more of a comment, actually. In challenges to achieving the goal, you talked about affordability. In it, you talk about gaps in local support services for residents with complex health, care and social needs. This is basically to keep people in their own homes. I would also think that you need to add in there dementia or Alzheimer's, because it's very important for people who suffer. I could testify. It's very important for people who have dementia and Alzheimer's for them to be kept in their homes for as long as possible. And I think we could do with adding that in.
Yes. Yeah, thank you, Councillor. I think that's true. I think we would work very closely with Adult Social Care and West Sussex County Council on that, because clearly what we do as a council is provide sort of general needs housing. We don't provide the necessary support. But if we can get other agencies involved and to keep somebody with Alzheimer's in the environment with which they're familiar, then clearly we would want to do that. And it's working with other agencies to ensure that that happens. So that's an ongoing discussion. I sit on the Adult Safeguarding Board for West Sussex County Council, representing the district and boroughs, and this is a constant refrain really of how agencies can work together to keep people safe and secure and in their own home. So that's something very much at the top of a number of agendas.
Councillor Clark, were you wanting something specific in the strategy to mention dementia?
I'd like that mentioned
Yeah.
somewhere in the strategy, but it hasn't been mentioned.
Yeah.
Unfortunately, what I can see around the right. And the point of keeping people in their homes for as long as possible, rather than trucking them off to an old folks' home, is very important. Because once they go into an old folks' home, often, not always, but often, it's down.
Thank you. And if anything is to go into the strategy, I suggest dementia, not Alzheimer's, as a general term.
Yeah, dementia's fine. Fifth point, it's one of style, really. When I read this, I thought, I like positive style, and I think it's very good, but it leads to challenges like, in the cabinet paper, it says, prevent all forms of homelessness. Immediate, how the hell are you going to do that? And looking in the text, we want to stop homelessness before it starts. How are you going to do that practically? So you might tweak the words, maybe, I don't know. If you want to stick by it, that's fine by me. It's just at least the challenges from people like me of saying, how the hell are you going to do that?
I think we discussed some of the tweaks, didn't we, at the meeting? And I think that Councillor Ellis Brown raised it.
So at the members' briefing, we agreed to change the prevention one to aim to prevent. So it's, and then the second comment you mentioned was, sorry, I've lost what they're talking
About preventing homelessness before it happens.
Yes, preventing homelessness before it happens. So that's in relation to KPIs and tracking. So if we bring our rough sleepers in-house and the extra prevention work we've got, we want to start working with people before they become homeless, and that's the government's stance at the moment, as well as much prevention work as possible. We don't want people to be becoming homeless. We want to work with them beforehand. Do you want to add in?
Only that we could add a supplementary verb along the lines of aim to prevent homelessness before it happens. So that is the big sort of push, always has been ever since I've been working in homelessness, and certainly since the Homelessness Reduction Act of 2017, is about prevention. But I see the bold statement needs to be moderated, and we will do that in the final.
Thank you. As I said, I don't have a problem with bold statements, but I think it just leads to challenge, really. Thank you. That's it. Thank you, Chairman, for your indulgence.
Thank you, Councillor Clark. Any other members have any questions? I'll open it up to non-members then. So, yes. Claire Vickers, sorry, Councillor Vickers.
Thank you, Chairman. I welcome this homelessness strategy. I'd like to thank the officers, particularly for the briefing we had last week and for this very full report. This question might be difficult to answer, but how might local government reorganisation impact on this strategy?
So this strategy takes us to local government reorganisation. We actually had an interesting conversation with Crawley Borough Council yesterday in relation to what our relationship will look like moving forward. I've been given the lovely project of that. So we are going to have to merge our housing register and the likes of that, and it's a big piece of work. What this strategy actually gives us an advantage is we've set out in clear paper what our strengths, what our weaknesses, where we want to focus on in detail for the next 5 years. So when those projects start looking at, everyone's going to look to us and go, here's what they need, here's what their current challenges are, and it's fresh, new, and a live document that's moving with the times, whereas other councils will have more outdated ones that are likely going to run out maybe next year, the year after. That puts them at a bit of a back burner. They'll be talking about things still like COVID and outdated matters, whereas ours is going to be more relevant, hopefully, and then we'd be in a better position to say, follow our lead, basically.
Can I just come back quickly? My concern is about the relationship between us and the other authorities, whatever they may look like. Will we be competing for the same pot of money, or will we still get the support from government? It's a question you might not be able to answer.
No, yes, thank you, Councillor Vickers. No, we can't really answer that. We don't quite know what it's going to look like and what the new authority will look like. But I think our concern is that what we are employed to do is the best for our residents in Horsham District. And so the strategy addresses the needs of Horsham District hopefully, as Elsa says, has innovations, strategic aims that will be, you know, I don't want to say a lighthouse particularly, but show how things should be done, and then others can follow. And we'll be involved. Whatever happens, we'll be involved, and we don't know how it's going to look. We'll be involved in sort of shaping the housing offer for the new authority, and so we've got to make sure that that works and it works for our residents.
Thank you for that.
Thank you. Councillor Vickers, has that answered your question there?
Yes, thank you for that reassurance.
Thank you. Any other non-members like to raise any questions? Councillor Raby, did you have anything to say as Cabinet member?
No, other than to thank Elsa and Andrew for all the work they put in and for the excellent questions as well. Thank you, Chair.
Thank you. All right, so I think we can now move on to item number 9. Andrew, sorry, you're back on again. This is a contract for supply of services with Age UK, West Sussex, Brighton and Hove. A verbal report from the Head of Housing Communities. So I'll head over to you, Andrew. Thank you.
Thank you very much, Chairman. Yes, so what we're looking at implementing with Age UK, West Sussex, Brighton and Hove is for the delivery of services to older people. I was terrified when I looked at this. 50 plus is older persons, and I well and truly fall into that category by quite a few years. And that will be for 150,000 over 3 years. Now, we recognise the value of service provided by Age UK, which is the only local provider that gives an overarching range of services to the older population. This is not new money. So in the past, we provided Age UK with a strategic grant from our pot, but we want to make that much more formal so that we can be aware of the services, there's more reporting, there's more engagement, there's more proper partnership working and targeting of what our older residents need. We have an ageing population, we know that, and we need to continue to ensure that there are suitable services available for older people across the district. So as I say, moving from a grant to a contractual arrangement brings the service in line with similar arrangements, for example, at Mid Sussex District Council, and will make, I think, help to make any sort of transitional arrangements into the new authority when it's created. And the 3-year agreement gives Age UK some assurance that the funding will come, and also more accountability of them to us to report on the work that they are doing, because every year they apply for the strategic grant, and that's a bit ad hoc. This is a much better way of doing things. So just really to highlight some of the services that Age UK provide for us, I think that's important. There's a community hub that offers a range of activities for older people, free and confidential advice on a whole range of topics, services to support people with dementia and their families. We've already speaking about that, and that's a real issue. A help at home service, and a home and settle service, which offers immediate support for people who are coming out of hospital. So that's a really valuable activity that Age UK provide. And what they call community agents, and a social prescribing service, which means bringing all sorts of agencies around those in need to connect people with those services. So it supports our priority of supporting people in communities, helping people through the cost of living crisis, because Age UK do a lot of work in that area as well, along with our friends at Citizens Advice, and understanding the needs of the communities so that we can deliver the services to enable people to live long and active lives. Fits in with Nick's active wellbeing strategy and the work we are also trying to do with housing providers in providing homes for people that kind of move with them as they get older. So from this point, then officers will be working with legal colleagues to draw up a suitable agreement. I think the reason we're coming here this evening is just to share this with you. It's quite a lot of money, but it's money we've already budgeted for, and it'll be a cabinet member report. I'm happy to take any questions, Chairman, on that.
Thank you, Andrew. Yeah, 50, that's a bit scary, isn't it, age? But thank you for your report. Does any committee member have any questions on that update? Anybody else? Any other non-committee members? Sorry, Councillor Bateman.
Could you just tell us a little bit more about the community hub and how we will ensure that it is delivering good value for money? Because obviously, if we've only got one hub, how are we making sure that its benefit is spreading? Because obviously, if you get older, it's much harder to get into the centre.
Thank you, Councillor Bateman. I think what I'd like to do, rather than try to sort of pull things together now, is I will go and have a conversation with Hayley and Stacey and get really more sort of detailed information about what it does and how it works. And I'll make sure that you have that and I can copy in the committee. Is that all right, Chairman, if we do that?
That's fine. And Judy, if we share that response, thank you.
Yeah.
Thank you. Councillor Clark.
Just one quick question. On paragraph 2.3, why change is needed. It basically said the current leisure model is traditional and heavy facility based. What does traditional mean in context to what we're looking to do? What's meant by that?
In terms of working with older people, a day centre. So the kind of old model of the day centre where people would come and sort of knit and natter and stuff, that's not really what, well, I'm 64 and I don't know that I go to a day centre, but I would want to engage in a range of activities through the hub and enjoy all those things that now Age UK are offering. So I think that term specifically refers to the old model of a day centre.
Any other questions or from non-members? Any questions? Okay, thank you. Andrew, does the Age UK link in with the HDOPF, the Older People's Forum at all?
Yes, it most certainly does, yes.
Thank you. Okay, I think we've finished with that item. Thank you very much. Item number 10 is active wellbeing strategies, pages 47 to 56 of your pack. We're going to receive an update from the Head of Leisure and Culture, Nick Jenkins, to provide us with an overview of the strategies and subsequent procurement processes. Please note a members' briefing will be arranged and a draft cabinet report will be presented to Finance and Performance Policy and Scrutiny in due course. I know Nick is passionate about ensuring we have a healthier and more active communities whilst reducing inequalities. We're also looking at ambitious shifts from a traditional approach whilst also responding to financial pressures. To make it even harder, we've got a growing and ageing population. So over to Nick.
Thank you very much, Chair. You've nearly done the presentation for me. Thank you. And I note the word traditional was used before around traditional sort of services for older people, and we sort of have a traditional leisure offer. But as discussed with the Chair, the strategy is still work in progress, so I can't offer a review of the strategic document, but what I can do is talk through what we mean by active wellbeing, the model it uses and the possible benefits it can offer and bring for the Horsham district. I'll also provide an overview of our current leisure offer and some of the things we need to be mindful of in these conversations, like a growing demographic, but an ageing one with failing healthy life expectancy alongside rising life expectancy. I need to get that right. So a failing healthy life expectancy alongside a rising life expectancy. And I'll delve into that a little bit more later. So the work covers three main areas, which are all linked. This presentation focuses on what we mean by active wellbeing, but it will lean into the other elements in the other areas. The drive to review our leisure strategy comes from the fact that our current leisure management contract for our leisure centres expires in December 2027. The procurement process to award a new contract will start in August and September this year, and so it's logical that we review and update our strategies accordingly. This is a once-in-a-generation opportunity to ensure that we not only are providing a good and strong leisure offer, but also shape the contract so we have the ability to target and impact other priorities and needs that our communities face. This work doesn't come out of nowhere. Between November 2024 and March 2025, we carried out a diagnostic review of our leisure services with the Leisure Consultants SLC. This involved a high level of engagement with key members, officers, stakeholders and partners, and 5 themes were generated from that. Our facilities perform well, but are at capacity and unlikely to meet future demand and need. Strong support for leisure to play a greater role in health and well-being. The new contract provides an opportunity to extend reach and impact of service by diversifying programming, delivery of activities in community settings and strengthening partnerships. There's a strategic role for the council, should be reviewed to understand requirements for investment to meet need alongside whole life cycle costs. And whilst a challenge, LGR provides an opportunity for the council to establish a clear role for leisure to support the wider system by embedding a service which contributes more to the wider health and wellbeing need locally. We could procure a leisure contract based on a traditional model, but that we currently have. It performs okay and generates a positive management fee. But based on the diagnostic review, the key recommendation that we pivot to an active wellbeing model, and work started in October 2025 to explore and develop an active wellbeing strategy and an active wellbeing investment strategy. The current situation, there's positives. We have a strong core membership of about 6,500 for our leisure centres, and attendance rates have recovered well past COVID and have grown year on year since 2022 and are above average now. The levels now stand at about 1.1 million attendances across the year, which is pretty amazing. The initial management fee was set at 200,000 a year in 2012 when the last procurement was done, but due to inflation and the opening of the bridge, this has increased across the contract term, meaning the management fee generates 7.5 million across the term. We're already doing things that support broader health and wellbeing through our leisure centres via our health and wellbeing team, like exercise on referral and men's health challenge, which is great, but it's patchy and prone to change as our current contract doesn't include some of the requirements necessary to support some of these programmes. The challenges. We've got ageing facilities that require investment to stand still and to cover whole life cycle costs. The bridge is relatively new and completed in 2018, but the pavilions was built in 2002, Billingshurst in 2008, and Stenning in 1991, although it did go a small refurbishment in 2011. On top of this, further investment will be needed to enhance the facilities to meet demand. We are over capacity in many areas with high demand on sports halls and studio space, swimming and health and fitness. For example, a typical benchmark for a high-performing gym is between 25 and 30 members per station, but ours are currently operating at an occupancy level of 35 members per station. Whilst this is a positive sign in terms of demand, it's starting to have a negative impact on our user experience. And as Horsham has an expanding demographic, this is only going to go one way. Workforce in leisure has low salaries and high staff turnover. This can mean that it's a challenge to ensure that we have necessary qualified staff to deliver certain activities. For example, delivering exercise on referral requires a level 4 gym instructor qualification, or to deliver activities to improve balance as part of the falls prevention programme requires a PSI qualification. All require investment for development by the contractor. We are obviously monitoring LGR with reference to any Section 24 direction, and I'm working with legal to understand this. But given the current leisure management contract expires in December 2027, the instruction is work as usual. However, we are mindful that entering into contracts will require consent at some point. Demographic, a few people have mentioned today that we have an increasing and ageing demographic. The census figure shows and predicts growth across all age groups, but with a significant increase in the over 65s. In 2021, 23% of the population was aged 65 plus. This is set to rise to almost 30% by 2041. Some of you have known that I mentioned something called the old age dependency ratio. This is the number of older people over the age of 65 compared to the number of people of working age. In 2021 in the Horsham district, there were 384 people aged 65 plus for every 1,000 people of working age. This is set to increase to 560 by 2041. So over half our population within Horsham district will be aged over 65. If you enter old age in good health, it's not necessarily an issue. However, the trend for rising life expectancy but falling healthy life expectancy, as I've mentioned, across West Sussex, which includes Horsham, means people living longer but in poorer health. We all know the pressures that health and social care services are currently under and the tremendous financial strain this brings. And without addressing some of the root causes that cause poor health, like obesity, poor diet and inactivity, along with wider social factors, the situation is probably unsustainable. Just as a counterpoint, I've put a couple of stats in there about weight. So rather than focusing on older people all the time, so 17% of our 4 to 5 year olds, 25% of our 11-year-olds and 50% of our adults are classified as overweight and obese. This is something to bear in mind as we go to the next slide. So it's not a very cheery slide, I'm afraid, but the left-hand column shows the top 10 causes of death in West Sussex. So I'll let you look at those for a bit. The top one, neoplasms, refers to cancer. Cardiovascular disease is self-explanatory. Neurological disorders are things like stroke, and you can work out the rest. The right-hand column shows the top 10 risk factors which lead to poor health and death in West Sussex and Horsham. So again, I won't read those out, you can look at them. But in short, tackling major causes of ill health, mortality and premature death will have the biggest impact on population health. The word here is prevention. Addressing core lifestyle risk factors like smoking, inactivity, diet, alcohol, etc. prevents illness before it starts. Offering the biggest gains in health life expectancy, especially for those who experience health inequalities. This leads us nicely onto what we mean by active wellbeing. The pivot from a traditional leisure to active wellbeing is a way that public leisure services can adapt to stay relevant, sustainable, and play an increasingly purposeful role in wider health and wellbeing of our local communities. We all know that leisure centres, swimming pools and gyms already play an important role in supporting people to be active, but we also know that only 10% of our communities actually use them. This pivot involves a shift in mindset and focus, a changing language, a different look and feel, a more diverse range of activities and an upskilling of the workforce, all designed to meet the needs of more of the other 90%. Critically, the pivot to active wellbeing will be more appealing to health partners and agencies who up until now have perhaps looked down their noses at leisure as being all about gym memberships and vending machines full of unhealthy snacks. The sector is already seeing this change through recent procurements across the UK, and operators are gearing up to respond to these new requirements. Most have taken on new senior staff to lead on the approach. All typically have local leads in place, and some have adopted new group-wide strategies which set out their corporate commitment to shifting the dial much more towards the 90%. The introduction of new active community programmes which focus on outreach through delivery of activities and services in community settings are now commonplace in contracts, and some councils are looking to pivot further through contract specifications which focus more on meeting the needs of the less active people. This is perhaps a future vision for what active wellbeing on a neighbourhood basis could look like within the Horsham district. The operator partner or the contractor could be positioned at the heart of this, delivering services that are outward looking, working with multiple partnerships, using local knowledge and building relationships to make connections within communities and across services. They can play both a direct and enabling role in helping people move more through a more responsive, needs-led service model, delivering core services within facilities alongside wider wellbeing, healthcare, prehab and rehab services, all underpinned by a much greater emphasis on addressing health inequalities through prevention and early intervention. It would adopt a hub and spoke model where a well-resourced leisure centre or active wellbeing hub will coordinate and deliver a wide range of active lifestyle and preventative health opportunities within its facility, but also through a network of local satellite locations. So the hub and spoke model. The hubs are the leisure centres. They become hubs acting as active wellbeing centres, maintaining a strong offer for the active well, but also offering specialist and dedicated spaces with equipment designed for older adults, rehabilitation, or those new to exercise, offering gentle guided workouts in supportive social environment, making fitness accessible and less intimidating. It can also offer rooms for partner organisations to use for consultation and advice, generating use and promoting the facility as a destination serving the community. Spaces like these also drive membership and income, with people getting used to the leisure centre environment and then taking this step into leisure centre proper. One recent leisure centre recently installed something called an Enerva suite, which comprises of power-assisted gym equipment designed for rehabilitation and older adults. This attracted, over the course of a year, 400 additional memberships to that leisure centre. The spokes. These are smaller, non-traditional sites, such as schools, community centres, parks, or digital platforms that extend the hub's reach into local neighbourhoods and communities. These sites are designed to meet specific local community needs and overcome common barriers to participation, such as travel, distance, cost, or social discomfort. The programming. Programming is focused on prevention, as I've mentioned, rather than reactive care, and is designed to be inclusive and scalable, with the ability to add to the network reach underserved areas without duplicating high-cost infrastructure. It also offers sustainability by linking smaller, perhaps less cost-effective schemes to larger hubs, and improves resilience through shared cost and professional development. The partnerships for active wellbeing relies on a whole system approach, with key partners from the health and social care sector partnering with the physical activity sector to integrate pathways into clinical health and care systems. We have already engaged and spoken to Public Health West Sussex, Sussex NHS, Adult Services, Children's Services, and a broad range of organisations from voluntary sector, with them all acknowledging the benefit that active wellbeing model would bring to providing significant input into the preventative health agenda. I'm nearly there, don't worry. So to recap benefits of active wellbeing. So reduce pressure on health and social care, the preventative measure. Lack of exercise is one of the big four causes of preventable ill health, alongside smoking, poor nutrition and alcohol excess. Being physically active can prevent dementia, type 2 diabetes, some cancers, depression, heart disease and other common serious conditions, reducing the risk of each by at least 30%. A shift to an active wellbeing will support better health outcomes and reduce the burden on GP appointments and acute health services and social care, particularly relevant to Horsham with an ageing population. Improve population health and reduce health inequalities. The current service focuses primarily on the active and engaged. Protecting this will be important from an income perspective, but the active wellbeing service will be targeted more at people who are inactive, isolated or living with long-term conditions. It will reach groups who don't engage with traditional leisure services and support the councils and partners' public health objectives around obesity, mental health, ageing well and long-term condition management. Supporting mental health wellbeing. Being active reduces stress, anxiety and makes people feel better about themselves. It also helps combat loneliness and social isolation. Supporting community cohesion. A broader active wellbeing service will support more community-based activities and build confidence and belonging. It will connect residents to local groups, support volunteering opportunities and build stronger more resilient communities, increased participation. A wider active wellbeing service is designed to appeal to a much broader audience beyond the 10% we've already mentioned. There is a potential, therefore, to increase participation in not only the leisure centres, but in parks and green spaces, walking routes, community venues, helping the council maximise the value and use of its existing infrastructure. Strengthening partnerships, an active wellbeing service better bridges gaps between GPs, social prescribers, leisure providers, voluntary and community organisation. The council will benefit from a more coordinated place-based approach rather than fragmented services. Repositioning of the service linked to LGR. As we move through LGR, shifting to a broader active wellbeing service will make it much more relevant in the eyes of the bigger statutory services like adult children's services and public health. There is an opportunity to establish it as a genuine enabling, supporting function to these services rather than just a service for the already active engaged. It will encourage stronger collaboration across the wider system as other services and partners see the value of a more targeted and impactful approach. It will have an environmental impact, promoting active travel and outdoor activity, which will support the council's environmental priorities, reduce carbon emissions and encourage sustainable use of Horsham's countryside and green spaces. Financial, a proactive operator or contractor working in effective partnerships will develop a thriving programme which will reach new markets, increasing activity and income at core facilities and community settings. This will also support the continued strong performance of the management fee to the future local authority. It also leans into the great place to live. Effective delivery of the wellbeing vision will further enhance Horsham's district as a great place to live, recognised regionally and perhaps nationally, with activity opportunities for all within their community. So next steps, you can see them there. Development and completion of the active wellbeing strategy and the active wellbeing investment strategy, which will go to Finance and Scrutiny Committee in March. The active wellbeing investment strategy will indicate what the whole life cycle costs are predicted to be, along with any improvements we wish to make to the sites to accommodate a shift to the active wellbeing model. The intention is to have these signed off by the end of March so they can inform the early stages of the procurement process, which will include a period of market testing with potential contractors before we go into procurement proper. Hopefully the presentation has given you a broad overview of the current leisure provision, the potential future demand against an increasing population, and how a pivot to active wellbeing model can not only provide ongoing provision for our active well, but deliver opportunities to tackle impact the significant health issues that do and will continue to affect our communities. Thank you, Chair. Sorry, it's quite long.
No, thank you very much, Nick. There was a lot of detail, but I know you're very excited about this opportunity, so thank you. I'm glad to see in there the inclusion of programmes such as falls prevention. Falls are the second leading cause of unintentional injury deaths worldwide. And in the UK, 250,000 emergency hospital admissions are due to falls, and they are usually income related. So I'm glad to see that's included in the strategy. I would also like to support the continued approach, which includes parks. I first met Nick on a Learn to Run course many years ago. He's very good, by the way, running. And it's just that use of things like our parks mean that it's not always the traditional equipment use, but getting healthy in sort of the outside is very good. I also liked the hub and spoke reach out to residents where they live. Use of parish councils, use of village halls, I think in the future would be very good as well. I would like to ask you a question. I think that might also be a question that Councillor Jeffrey has, is about how you're going to measure your success of this whole system well-being approach on the short and long term. And as we move to, I think you've touched on it, but as we move towards local government reorganisation, parish councils are asking about their interest in assets on the leisure centres, and with contracts up for renewal, parish councils showing interest, how might that work? Over to you. Thank you.
Yeah, in terms of measurements, the new strategies will include clear action plans. The progress can be tracked against. We will develop smart measures for our new contracts that will be monitored through our regular schedule of contract review meetings. So whatever we put in place, we will have a pretty comprehensive measurement about how we can do that. Sorry, the second question.
Yeah, asset transfer questions.
Yeah, so at the moment, if we've got a leisure asset, I think the decision, and I might defer to Paul on this, would be that we would keep the asset if it's an income generated thing like a leisure centre.
Do you want to say anything on that, Paul?
Yeah, I mean, obviously any parish council can submit a request for asset transfer, but I think, you know, it's a point of principle. If it delivers an income to the local authority, we would be unlikely to transfer. And secondly, from a contract management perspective, if we were to take a site out of our contract and into another contract, there's increased cost there for the public sector and for the provider. So I suspect my view would be that we keep the contracts together.
Thank you. I think we're going to have a lot of questions on this. Councillor Bateman, was it specifically in response to the expression? Okay.
So I've actually got two questions. The first is whether or not we have done the research as to whether or not the spokes are adequate, because obviously if it relies on there being enough spokes in communities, then it's not going to work. So obviously I live in a town now which doesn't have a park, and the school is already where the leisure centre is, so there's no capacity there, and the community centre is already over capacity. So it's kind of, okay, are we looking at the capacity of our system to deliver spokes? The second is in relation to, you know, the stated aim is to improve public health, and obviously that's something that the central government have also set as an ambition, and it's absolutely the right thing to do. But what I want to understand is whether or not we are actually looking at the reasons why there is a lack of public engagement in active lifestyles, because the reasons for that need to be understood. Otherwise, we are throwing investment at a problem that maybe we cannot solve. For example, when I did the work on, you know, trying to find out what the barriers were for, listening to teenage girls, the first thing I uncovered was that female activity levels are far lower than they are for men, and they drop off from the age of 10 onwards, and they keep dropping. Because obviously, when it comes to women and their activity, that women are still predominantly the people with caring responsibilities. And when a woman gets home from work is not finished. So it's trying to understand what are the reasons why people are not engaging in active lifestyles, because if we don't engage with that, then all our efforts might be for naught.
Thank you. Yeah, some big questions there. Yeah, I think that the spoke model is one that sort of exists in places as well. We've got a good track record of working with partners, and we know that there's a lot of activity that already occurs in places, which also brings an issue around capacity within those facilities. So I think what the model would do would look to work with those partnerships to try and expand them where we can, but they're also then scalable. So we'd be looking at demand. So part of the offer would be, you know, if you're in Billingshurst and you want gym equipment in something, how can we bring that in to an open space to do that? If you've already got an activity that's going on within a village setting, how can we lean into that and provide assistance? So whether it's a greater opportunity for more people to do that. So it would be, a lot of it would be through partnership. Facilities is a slightly harder thing to do because it's obviously a longer term thing. As I've said in my presentation, you rightly highlighted, there is a lot of demand on facilities. Currently our model shows that we do have capacity within some of our sports halls, and part of it is to do with programming. So that's quite tricky, and that's quite a long, hard thing we've looked at in the past. So you could have a facility where somebody has booked, say, I don't know, a badminton session at 2:00 in the afternoon, but you could have somebody that wanted to book that hall between 2:00 and 5:00 to provide a whole raft of activities. So there may be a smart bit of booking that we need to do to free up some of those activities. I think it was a couple of years ago, we did a study on our capacity of halls, and I think there was pressure on it, but it came back, I think, and I'm trying to remember, it was a few years ago now, that we had adequate hall provision. It was probably that it wasn't utilised to its fullest. I think that's right, Paul. Yeah. And the second one, engagement. Look, I'm not going to say that it's going to be easy, because it's not. I think I'd be lying. I also want to make sure that, you know, we understand this isn't going to be a panacea for every health issue that's out there. Engagement is always, in healthy lifestyle choices and behaviour change, is a big ask. We currently have the health and wellbeing team downstairs from here in the health and wellbeing hub. If you haven't been, please go and see them. They do some amazing work, but they will already tell you getting people to engage with behaviour change is one of the hardest things to do. People that do make significant improvements, and we've got numerous case studies to show that if people can commit, and it takes support, and it sometimes takes several times, and it sometimes takes quite a lot of engagement with them and routes in to do that, but you can make change to do it. So I haven't got an answer for you about how we do that, but what I can say is we obviously need to improve the engagement, get people to engage with this process. And by putting these things in place, particularly around the hub and spoke model, you know, if we can challenge what makes it difficult to engage, for some people it just will be location. You know, can I get to a leisure centre? No. Do I want to go to a leisure centre? No. We've already said only 10% of people go to leisure centres. That could be a variety of reasons. It could be cost, but it could be a social thing, it could be location. So there's a whole raft of things that we would need to look at to improve engagement.
Does that answer your question for now, Councillor Bateman?
I think in part I just want to see us digging into the reasons as well, rather than just offering solutions.
Yeah, sorry, noted. Thank you.
Following on from my comment about the use of our parks, I think Councillor Beard would like to, I'm going to put you on the spot, Councillor Beard would perhaps like to raise a comment further on the environmental impact and promoting outdoor initiatives, and potentially also the high costs of facilities for the youth.
Yeah. Two points and a gratitude. I just want to mention Chanctonbury Leisure Centre and the amazing work that they do within the community beyond. So they are doing the active, but they're also going far above. They are extraordinary. I just want to really celebrate them. My 2 points, the first one is young people. Following on Sam as well, it costs between £25 and £30 a month plus joining fees for young people at the ages 11 to 18 to go to a gym. I, as a mum of two, not a chance. I've got two boys who are desperate to go to the gym. I can't afford it. And I think that's a real shame that there is that barrier. And if we can get them into the gym young and having an active well-being, you know that, then that does continue after they've left college. So that's my first point. My second point, if you take a handful of soil, there is more microbes in that handful of soil than there are humans on this planet. And those microbes do more for our immunity, our health system, than anything. So if we can actively persuade and support and include within the strategy that active wellbeing isn't only within the four walls, as Victoria was talking about, it goes beyond, it goes into the parks, it goes into incredible organisations that I know the Will to Wave support, Stenning Greening, Billy Green, Roots CIC near us, that are getting people out. So they're not only getting their vitamin D, increasing or lowering their heart disease rate, restoring focus. As humans, we can see more shades of green than any other animal. We are meant to be outside. So if we can help encourage those beings to be outside, to work within their active well-being, but also support our beautiful world, and how we can get humans to re-fall in love and learn how the old skills of coppicing, that's Roots CIC, what they focus on, how we can get them to be active at the same time as falling in love. That's, yeah, thank you.
Nick.
It's not going to take much for me to absolutely underline and support your praise of Chanctonbury Leisure Centre. Andy is an amazing guy down there. It'd be fair to say that I think he already runs an active wellbeing hub down there. It's a model that we recognise. We work in partnership with him. We've recently set up a leisure forum where any leisure operators come together, and Andy is part of that. So totally agree with you. In terms of, what was the other one? Oh yeah, cost. Part of this needs to look at that. You know, we have something called the leisure access card. It'd be fair to say that it doesn't operate very well at the moment. It's a little bit in abeyance. When it was active, it did look at subsidised rates for certain people under criteria. I think it would be fair that as we go into the new contract, we consider that. If we, you know, and I think the leisure access card was traditionally based on an income basis. Why don't we look at this? It could be on a health basis as well. You know, so I think we need to review that. That's currently sort of in my work log, shall we say. It's been stuck there for a while, but I think it's relevant that we review that. And if there's a need and a desire to work in subsidised places within the traditional spaces, I think that's worth looking at. Outdoor spaces, absolutely intrinsic to this model. Green spaces and blue spaces, which is relatively new to me, need to be explored because they are intrinsically accessible for people if they're on your doorstep, if you're lucky enough to have that. And again, it just works at every level in terms of, you know, green gyms. You know, when we talk about activity, it doesn't have to be within four walls. Absolutely not. We also run, I don't know if you know this, we run quite an extensive range of healthy walks program. So through the Health and Wellbeing Hub, we help support a whole network of volunteers who I think run about 50 free health walks across the district a month. Anybody can attend those, and they are specifically designed to make social connection, but by dint of being a health walk, they are outside and they explore some of the wonderful countryside that we have. So 100% that's where we're going. Or that's what I'm suggesting where we go. It's not my decision, obviously.
Thank you. And I think that's something as councillors, when I do my update reports as a councillor to the parish councils, I mention those walks if they're in their area, and I think that'd be good that we all do that as well. There's no better exercise than being outside. My husband does the green gym and the volunteer sector, and there's nothing better than spending a whole day pulling out brambles to do the best exercise. So I agree with that. Thank you.
Just quickly jump in there as well. I think that's also really relevant to make a point. If you look at Sport England's indications of activity level, they have 3: inactive or moderate. You get one where it's called, I think it's called reasonable activity, and that means that you'd spend 150 minutes doing moderate exercise across the week. Now that can include, what it means is it gets your heart rate up and it makes you warm. That can absolutely include things like green gym. That's the metric that they use to see if you're active. Sorry to interrupt.
I think we're all furiously agreeing here, so thank you. Okay, I know we've had some questions in advance from Councillor Jeffrey, so perhaps we'll just cover that off. The questions from partnership with external bodies, contracts in section 24, progress reports and benchmarking, capacity issues and skill requirements. I don't know if there's anything you specifically want to raise this evening in the public forum.
Well, I'm not going to go through all of those. As I said, not keep us here all night. So I think Nick has answered quite a few of those in advance, just before the meeting. Just what I wanted to come back to, just to clarify really what is going to be materially different for residents with the proposed active wellbeing model, because we've talked a lot tonight and come back to the traditional model versus the active wellbeing model. As we've already talked about, our current centres are already at capacity. So I think I'm really supportive of this active wellbeing strategy. My concern, I suppose, comes with how we're going to implement it. I think it's fair to say that the leisure team is under-resourced. It's one problem as per our previous conversations, it's just about implementation, I think, is one of my concerns. How far are we going to get with this? There's all kinds of challenges coming down the track, LGR causing uncertainties, other challenges, the capacity challenges in themselves. I mean, for example, one of my questions would be, we've talked about moving away more from that traditional model, but that traditional model is also popular with a lot of people, hence why our centres are already at capacity. And as somebody who is a member of our leisure centres and trying to get out of the 17 to 56% statistic of being one of the obese adults in the district, you know, I suppose we want to grow our leisure, the active offering, but at the same time we want to make sure we're obviously not turning away those people who are after the traditional leisure offering as well. So one of my questions: how are we actually going to facilitate both to the degree where we are going to have enough incentive to onboard those people looking for the more active well-being side of things, and the full prevention, everything is great and excellent, and linking up more with our well-being hub and the active, everything we've just discussed. But how are we actually going to facilitate that? So, for example, you know, are we going to utilise parts of what we call the traditional leisure aspect now? Or are we going to be cutting back on elements of that to facilitate the active side? And if so, are we then inadvertently going to actually be driving people away who want to retain that more traditional offering? Because what you might risk then if we go too far one way to the other is that, yes, it's great that we're trying to ensure that and take preventative measures, especially with the older demographics in the districts, with the fall preventions, that active side of it. But also, what you don't want to do, I suppose, is push too many people away from the traditional offering, and then those people are put off from attending the centre, and then they end up being the demographic coming up behind the existing one with those problems we're trying to prevent in the first place. So you might be able to offer a bit more detail on that.
Yeah, so firstly, the one about what would be different in terms of the contract. If we remember the contract that we currently have was done in 2012, and it's pretty reasonable, it's pretty good. You know, it did what it was meant to do. Don't think that's a problem. As we go into the new procurement exercise, we will be putting more in that. So, you know, if we're looking at specifics, at the moment the contract have no compulsion to have certain levels of qualification to deliver some of these services. So if you looked at falls prevention, you need to have what's called a postural stability instructor qualification. That takes quite a lot of time and money to do that, and it's very specialist. So if we want to do falls prevention for our leisure centres and with our current contractor, sometimes they have somebody on the staff that do that, and sometimes they don't. Our contract will compel them to have that. So we need to build that sustainability in there. But we would also look to partner with other organisations and other leisure centres. We've mentioned Andy down in Chanctonbury. I'm already in conversation with him about banding together with our leisure services so we can do combined training of staff. So if he's got 2 PSI instructors in Chanctonbury and we haven't got one in Billingshurst, it seems logical that we start sharing those services, but also if we need to train people, we share the cost of doing that. Level 4 qualification in gym instructor. If you're on an exercise referral program, you need that. And I think I said in my presentation, that's a bit patchy at the moment in our current contract. So we would build it in and compel those contractors to have that in place. Definitely in terms of what we would call the active well and the current users of our gym and leisure facilities, we do not want to put them off. We want to make sure that they stay there. Part of that is going to be increasing capacity. Part of the active wellbeing investment strategy, which I will bring to Scrutiny in about a month's time, I think it is, will lay out where we think we need to make investments for some of our leisure centres, and that will be putting additional things into them. So if you looked at the pavilions, for example, I can't go into detail because I haven't got it all. You know, we would be looking to put an additional maybe 200 square metres in terms of the gym. So that deals with some of the capacity we already have, but any additional capacity would come in. As part of that, I mentioned something called an Enerva suite. Now, if we're going to align with our partners and really mean and do what we say we want to do in terms of reducing the health needs that we have, we need to accommodate some of those partners within those leisure centres. So the Enerva suite has bespoke equipment, so it could be 15 station, which are power assisted, which are specifically made for people who may be around falls prevention or rehab. That doesn't take away from the active well. That just put an additionality in there, so it's a stepping stone for people to come in. It could be rehab, but the intention would be once they've gone through rehab, they would go into the gym proper. And I think as long as we build capacity that's okay, because the active well will drive the management fee and the income for our contractor. So hopefully that's given you some confidence.
No, that provides a lot more clarity. Thank you, Nick. I think, as I say, my reservation that still lingers is capacity constraints. Because it's very ambitious, and I'm very supportive of it. But it's how we support the leisure team, i.e., you, on how we actually implement that, and maybe that requires looking further into further resource if we're actually going to be ambitious about implementing this program, especially when we're fighting along with timelines with LGR and the uncertainty that comes with that. With the fact that central government could put a stop to any further funding of projects at any time in the near future. So I think it's important that if we are going to be serious about this, that we actually give you guys the support you need to actually go forward with it. Otherwise, yes, it's ambitious and admirable, but is it actually deliverable? At the moment, I'm sceptical.
Yeah, I think so obviously when you talk about the leisure team, and it's sort of nice of you to raise the sort of pressure we're under. It's me and Rob, nod to Rob. He's been with us 2 years. He is an exceptional officer, very dedicated and knowledgeable and very driven. So that's great. But we probably can't do it alone. So when we go into the procurement, as ever, and which is what we've always done, we will probably do it alongside consultants to help us. Nevertheless, there is considerable pressure to do it, but I'm confident that we can do it.
Thank you. I don't want to spend. Is that okay for now, Councillor Jeffrey? And I think other questions can be answered by emails. I think we've got a lot of people wanting questions. I just wanted to say very, very quickly. Obviously, we've got quite a few 24-hour gyms, very competitive pricing. Is that something that you're looking at as a model, or are you trying to do it? Stay away from that.
We won't go into that arena, and actually, thank you for raising that. We have Gym Group across the road here. We have Pure Gym, which has just opened at Broadwood Heath. Very different operating models, big, stack 'em high, throughput's high. It's cheap, it's good, it's brilliant. It really adds to the models that we have. When I spoke to our current contractors about Pure Gym going into Broadwood Heath, we didn't have any concerns about that because it's a different offer. And I don't think that we would be looking to go into 24/7. So I think we've seen a slight decline in membership at Broadwood Heath, but it's minimal.
Just a different offering. Thank you. I know we've got quite a few hands up for questions. I just wanted to touch on something that we'd received in advance. I don't think we necessarily need to talk about it, but it was just to acknowledge that we're in receipt of a report titled How Leisure Centres Enable Sexual Predators, Women's Right Network Investigation 2025, and how design can play a role in tackling against male violence. So I just want to acknowledge that. I don't think we necessarily need to go into it today, but Nick's in receipt of that as well. Okay, other questions? I think we had a few hands up here. I think Councillor Trollope, did you want to ask a question?
Yes, thank you, Councillor. My question is more operational rather than strategic. I don't actually have any. I think it's all good what has been said so far. But I do note that Billingshurst, the swimming pool, they have continual problems with the tiles, and I just wanted to know if you could give a brief update as to how they're getting on with it and whether or not there is anything that we need to do to help them solve this problem once and for all.
Yeah, acknowledge the tiles have been falling off at the Billingshurst pool and we've been replacing them. Rob would have more details around this, but I think so far we've replaced about 40% of them, I think. So give us a couple more years and we would have replaced them all. But it is a concern that we're monitoring and we will replace. We normally, I don't know if you've seen how they replace them, but they do them with divers, don't they, to put the tiles back on.
My understanding is that the cost of draining the pool is a massive, and
you won't drain the pool,
and you would have to reheat it as well, which would also be a massive expense.
Yeah, there's part of it is cost and time, but actually, if you drain the pool, those tiles will come off. More tiles will come off, so actually, it's something that we wouldn't do, regardless of cost, because once all the weight of the water. I'm not a scientist. Loads of them will fail. So you would look at retiling all of it. So it is a problem. I don't have all the technical spec around that. But Paul, again, I believe that's what happens. Yeah.
Is it as simple? They need additional investment to fix it? Is it the lack of funds, or are they not dealing with the correct problem? Maybe there's something more fundamental.
I think we're at the moment we're in a repairing mode to make sure they're on, and we'll have to review that going forward about, you know, are they going to continue to fail or not. So we are aware of the issue.
I think as with time pressures, if that's okay, Nick, if you could perhaps respond
sure.
separately about that, thank you. Is that okay for now? Because I think it's slightly off topic.
Well, yes, if we could use this as a model moving forward as well, because I think some of these responses have been quite lengthy. Thank you.
Thank you. Councillor Livingston, I think you had your hand up earlier.
Well, thank you for putting together the idea of this strategy where you can outreach into rural places, into rural wards, such hopefully as mine on the eastern side of the town. But I think we're also missing another large part of our community. This is in some ways considered a commuting town. Now, I was a commuter, well, I still am. I still commute once a week. Right, sorry. I still commute once a week to London, but most of the people I travel with on train are 5 days a week. So they start off about 7 o'clock, 7:30 in the mornings. They're sitting on the train. They get into Victoria, they've got to have a short walk to the underground, they get to their desks, they sit down and work at the computer terminal. Now, that's an unhealthy lifestyle, and we need to engage with those people as well. They shouldn't be forgotten. That's a working age group, but could be getting more and more unhealthy because we're not being able to offer them. Because once they get home at night, they just want to, just turn the television on, have a meal, then go to bed.
That if you're suggesting exercises on the train as they go up, or
well, there's a railway station, there's facilities, just trying to get people engaged, with the
run to the station, or bring your collapsible bike or something.
Well, with somebody that once performed a pantomime on a train, nothing is beyond ability.
Thank you for raising the point. Other councillors, have you got any questions? Councillor Clark.
Thanks, Nick, for that. It was interesting. On a practical front, when you talk about spokes and stuff, the parish council put onto the recreation ground in Pulborough some outdoor gym equipment. I'm afraid to say that apart from kids playing on it when they come out of school, very few people use it. So have you got in mind some sort of strategy to up the visibility, if I can put it that way?
Yeah, it's a really good point. We've been putting gym equipment and calisthenic bars in some of our parks for a number of years. I'm a regular user of the bars in the park in Horsham Park where I live, and they're incredibly popular, probably more popular than the gym pods. Part of the offer, and part of my thinking process, if you like, is if you have equipment in parks, then what you need is a coach to go down there to drive engagement with them. I'm part of an exercise group that meets incredibly early in the morning in Horsham Park. You want to know when. And in discussions with them, part of what drives it is because you're going there to meet friends, or you're going to meet a coach. People like to be told what to do. They like given instruction. It's very hard to do it by yourself. So it's not beyond the bounds of imagination that the contract that we put in place could compel our contractor to do those outreach in those outdoor locations. So Wednesday morning, 10 o'clock, there's going to be a coach at the gym equipment. It's open to whoever it is. You get an hour's instruction to do that. That could be ongoing. We could do that because then not only do people get to use the equipment, they get a bit of instruction, there's social connection. I think the ambition would then be, what else do they do? I'd like to make further connections, so it could be that if you've got a local leisure centre, if you start in the park, it could be the aim that you start expanding into those other opportunities to do things like that. So part of that comes with infrastructure. Do we need to look at putting things in those open spaces? And then do we need to wrap around them with the instructions to an engagement? As we've talked about already, how do you get people to them and compel them that this is a really good idea? But yeah, absolutely.
Councillor Linto.
Thank you. Maybe now or at a future individual, could you expand on the digital platform piece? Because obviously the reverse of that is driving people to not exercise. So I'm just interested in how that knits in. Got some assumptions, but it'd be better to know from the experts what that component part is and how it interacts with everything else.
Yeah, it could be across many different things. So one of it could be that we get different workouts that we can send to people. So if you're in the park and whatever, you can download something and say, this is the gym equipment, this is how you use it. So it could be remote. There's no social connection there, but some people may like that. Some of it could be around nutrition. This is the plan that you're going to follow. Some of it could be, there's actually, I can't remember what the word is now, but they're trialling in pavilions. It sounds really strange, and I'm not sure if this is right, so I might have to be corrected, but they downloaded a digital platform for swimming. Sounds a bit dangerous, doesn't it? But what they do, they get it, I think it's on like an iPad thing, and they take it through into the pool and they do something around aqua aerobics as an individual. But I would need to check with my colleague in places if that's correct. Again, engagement through digital we could do. So there's a whole raft of ways that we can reach out to people to do that, really. Does that sort of answer what it is? I think one of the things we're keen on though is I think digital is good for engagement and it's good for information and it could be for startup. I think part of the active wellbeing model is very much about connection as well. I'm a great advocate for bringing people together, and that can take all sorts of approaches to do. Digital can be a great connector, as you will know. So if you can connect through digital, where is it a joining up type of thing that we do? I know you're an advocate for parkrun, so again, is there a digital version of parkrun where you bring people together that do parkrun but then want to go for a run on a Tuesday evening? Parkrun connections, I don't know what it would be, but it's that sort of model. I'm a parkrun runner, I go 34 minutes around the course, I'm looking to get a small group together to go on a Tuesday. This is the platform that you use as a meetup. It could be something like that.
Yeah, that's good. I was intrigued how that's gonna fit in, but of course it's the media of the now and the future, and by building that in, that's that engagement and capturing those audiences. So yeah, good.
Thank you. Any other councillors got any questions? Nick? Any other councillors? No? Nick, thank you very much for your time on that. I think we've dealt with everything, so thank you very much. Okay, moving on to item number 11, refurbishment and leasing of the property. This is pages 57 to 68 of your pack. As mentioned in the announcements, members will note that this includes an exempt appendix. Therefore, please be mindful of the restricted information and refer to the property as the premises or property X as lease negotiations are ongoing. Please further note that this information should not be disclosed outside of our meeting. The Cabinet's recommendation is to refurbish the premises to a sum of 900,000 and a contribution of 175,000 to facilitate their fit-out works. If members are happy to continue discussion, being mindful of the restrictions, we can do and move to exempt if required. So just a small correction to the agenda. It'll be Liz Williams, Head of Property and Facilities, will be providing the update, not as published, the Cabinet Member for Housing and Communities. So I'd like to move on to the report. Thank you.
Well, thank you. This property X has come to Cabinet before, and approximately a year ago now. It had planning approval for a leisure use, and and we are coming back to Cabinet for a similar type leisure use, slightly different arrangement in terms of the finances. It is something that's sitting vacant at the moment, and we wish to have it used. Yeah. So just if there's any questions.
Okay, I'd like to open up to any questions, being mindful of the restrictions to members of the committee. Any questions? Councillor Clark.
Thank you. I'll think carefully how I word this. I find it surprising that this paper is coming to Cabinet to ask for the release of over £1 million in view of the uncertainty of the outcomes behind this release of capital. So basically, we're looking to pony up £1 million, but the document doesn't cover any outcomes, and as I understand it, the outcomes are unclear. Speaking in code. So that's the first question. And the second question is, do we consider any other uses apart from leisure for this building, like, you know, converting the site to housing, for example?
Thank you. So,
Liz, are you able to answer that without needing to go to exempt? Thank you.
Yeah. In terms of outcomes, the majority of that funding is actually for the refurbishment of the building, which relates to the external fabric, which you would normally do anyway as part of it as a landlord. That is generally your responsibility, is the external fabric of the building. So that would be upgrading it and making it habitable effectively. And then in terms of the leisure use, there are restrictions in this area because of the site and its adjacency and to the Horsham Park, that it has to be used for a leisure facility.
So you're saying there are covenants on the site that force us to use it for leisure provision or leave it empty, basically, is what you're saying?
Yes, yes. There's it's to do with the way that the land came to the district council originally.
I still feel uncomfortable with ponying up this amount of money with an uncertain outcome, put it this way. And I would have expected everything to be nailed down beforehand, put it that way.
So we are in advanced negotiations with a prospective occupier, and by the time it comes to Cabinet, we expect that would be even further advanced, and it would just be subject to Cabinet approval after that.
Yeah, I went through this table and checked the numbers and everything, so I understand where we're coming from. But I think you understand what I'm saying in a veiled way.
Okay, thank you. Has that finished your questions, Councillor Clark?
I hope that was coded enough.
Thank you. Any other members wish to raise a question? No? Any other councillors attending tonight wish to raise a question on this? Looks like you got off quite lightly, so sorry you've had to stay so long. So thank you very much.
Sorry, Chair.
Yeah.
Just a quick one that's come to me. We're looking at, obviously we're talking about, you know, Councillor Clark, we're looking at nearly £1 million here for said property. During the period it's been vacant, is there a particular reason we haven't done the maintenance works on it during that period? Has there been maintenance works on said property during the period it's been vacant, which maybe would have kept that cost down, or is it just works that we're going to have to be undertaken anyway, regardless of the state of the the current status of the building, whether it were occupied or unoccupied, if you see what I mean.
While it's been vacant, it was temporarily used, and then when that finished, we haven't carried out any other further works on that. I'd say there would be a minor amount of deterioration prior to, during this period it's been vacant.
Councillor Jeffrey, is that answers your question? Okay.
Right.
Well, I think we've finished with that question. Thank you very much. Item number 12 is a follow-up report from the Task and Finish Group lease contracts, pages 69 to 70 of your pack, to receive an update from the Head of Property and Facilities. Pass back to you. Thank you.
So yeah, 12 months on, and we've adopted the longly worded social value lease discount policy, and had applications from community groups that were at the end of their leases, effectively, and although they've got protection under their lease for the premises to determine their rental and occupation going forward, we've applied the social rent discount, value discount policy. So that included applications from Scouts and Girl Guide groups, an older person's charity, and a bowls club. And initially, there was a lot of feedback about actually how much information volunteer groups had to provide. It's effectively like a business plan and a business case. Although when people did come on board, they actually found that there was some benefit in doing that, and they hadn't kind of re-looked at their constitution for some of them 25 years and things like that. So it was an opportunity to do that. However, some of those applications have now drifted away because of the community asset transfer policy that's come about, and so they've decided to move to more of a can we have this transferred to us, as opposed to let's work on a new lease deal. With each lease deal, we have had to get a market valuation and then assess the applicant's criteria against that market valuation to assess their rental and their capability. So one thing we've added is the governance area. So we have an initial area of financial ability, but we've added governance to make sure that actually it's a pass or fail. Do we move on to the next area of assessment? And to date, it has worked well, but there has been quite a bit of input required from groups which essentially are manned by volunteers.
Thank you. Anybody got any questions on that? No. Okay. Thank you very much for your time. Item number, where are we? Number 13, update from Task and Finish groups. So first of all, the non-financial S106 Task and Finish group have met again. We have Councillor Clark here, who chairs the group. Would you be happy just to give us a very brief update as to what we're doing and reaching out to the external bodies at the moment? Thank you.
Thank you, Chairman. Yes, we did a session on one topic, which was the impact at Bordridge Heath on a plot of land that was earmarked for a school, and also other 106 matters. We ascertained, basically, certainly from the legal point of view, very black and white, that basically it was all down to need, and if there wasn't a need, then we didn't need the land. And we will be looking at the 106 that was written, and we'll be looking at the 106, how 106s will be written in the future, because it's quite important to make sure that things are not perhaps dropped, put it that way. But I've still decided to invite the West Sussex County Council Education Officer to come to the next meeting more to let the group understand better how the mechanisms work and how the West Sussex County Council people work out the need, so that we understand better why and what happened and why, and how to avoid it in the future. So the work is ongoing, Chairman. If anybody's got any questions, I'm quite happy to take them with your permission.
Yes, of course. Anybody got any questions on the non-financial S106 task finish at the moment? Thank you. We have had a new task and finish group set up following our last meeting, which is the domestic lithium battery and solar panel installations that was brought out of our previous best task and finish. Met on the 5th of January. The members have been selected and have drafted the terms of reference for approval at today's meeting. Chair's been elected, that's Councillor Ellis Brown, and I'm going to ask him to read out the terms of reference so that we can check that we're all in agreement as we move forward. So bear with him while he reads out the terms of reference. Thank you.
Thank you, Chair. We did meet on the 5th of January, and we also had a presentation to help us with the terms of reference, and that was from the Sustainability Manager on domestic battery safety. After much discussion, we've now proposed the terms of references, which is as follows: to review any existing agreements between Horsham District Council and West Sussex County Council and their suppliers and installers in relation to the installation of and retrofit programme for domestic lithium-ion batteries and solar panels, to consider the risks associated with the domestic use of lithium-ion batteries and solar panel installations, and explore with partner organisation and relevant officers any potential mitigations within the scope of the agreements in place, to consider the current best practice guidance for installation and maintenance of lithium-ion battery and solar panel installations. And finally, and to review any customer information and promotional materials in relation to domestic lithium-ion battery and solar panel installation schemes promoted by the Council, and consider whether revisions should be recommended to ensure that any risks and the relevant mitigations are clearly outlined, in addition to highlighting the benefits of such technology. Finally, to provide an advisory document for those considering installation of lithium-ion batteries and solar panels to assist them in assessing the proposed offer and discussing safety installation. Thank you.
Thank you very much, Councillor Ellis Brown. I just noted on the last point there, it was lithium-ion batteries, you said, and we've got battery on our terms of reference. I don't know which one's been agreed for. Batteries.
Very my fault, and it does say, it does read lithium-ion battery, not battery, sorry.
Thank you. Just wanted to get, thank you very much. Are we in agreement with those terms of reference, or anybody got any comments? I will take that as terms of reference have been accepted by the committee. Are we all in agreement? Thank you.
It's worth noting we have on the task and finish group 2 people with extensive knowledge and experience in this area, and that's Councillor Livingston and Councillor Grant, and that's been very beneficial to both this work, this task and finish group, and the previous one. Thank you.
Thank you for commenting on that. Thank you. Councillor Trollope.
Yes, also, could you or someone clarify the membership? I was issued an invitation to the meeting and subsequently found out that I was not actually a member of that committee. I attended the meeting, it was interesting. I didn't have anything to add, as I know absolutely nothing about this subject. But yeah, and it's just a small thing, but it was just, if it could be clarified who the actual membership is.
I'll ask Democratic Services just to look through the emails received on that and how that came about. So sorry, but if there's been a discrepancy there, but Judy, we look into that for me. Thank you.
That's okay. And it was an enjoyable meeting. It was interesting, but I added nothing to it.
I think the chair can allow non-members to attend as an ad hoc basis anyway. Thank you. I think we previously mentioned another potential task and finish to do with licensing procedural gap. I know that county councils are exploring how that may be taken forward. Councillor Grant isn't here today, so we'll perhaps follow that up outside of this meeting. Thank you. Item number 14 is the work programme, pages 71 to 72 of the pack. Table shows the work programme for this committee 25-26. Does any member have any comments on the work programme? Any non-members? No. Thank you. The item number 15 is the Cabinet Forward Plan. There's also a link in your agenda, pages 73 to 78 of the pack. Any comments from members or non-members? Councillor Clark.
Just a thought occurs. It's a forward plan basically, but we also get a forward plan of cabinet decision of cabinet member decisions.
Yeah.
And the question arises in my mind is, should we not include this as well in this? Just a question.
Yes, because we review that at liaisons together, so it might be good to have that as part of the pack. Are we sort of in agreement going forward? That would be useful. We'll include that. Thank you. Thank you, Councillor Clark, for raising that. Urgent business. There is no urgent business. So at what are we at? 7:31. I will call this meeting to a close. Thank you very much and a safe journey home. Thank you.